Welcome to Skinside Out, where we uncover the science, trends, and truths behind skin health. Your trusted guide to the world of dermatology. This podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional.
Welcome to another episode of Skinside Out, where science meets beauty. I'm your host, Dr. Zain, and I'm here with PA Heather and my aesthetician, Courtney. Today we're going to be talking about a hot topic. Everyone's talking about the GLP-1s and how they're leading to massive weight loss, but its impact on facial volume and hollowing out, also known as the Ozempic face. So I'm sure you guys have all seen that in the media. As you can see in these images, these are all well-known celebrities who have been on GLP-1s, these medications that lead to rapid weight loss. And you can kind of see that hollow, deflated look that kind of almost makes them a little, sickly looking.
This needs a jump scare warning.
Yeah, so I think this is a really, hot topic because so many patients are on it. We've had many of our patients come in with great weight loss results, but have had a lot of hollowing effects.
People that are on these medications are investing in themselves. They're trying to feel more self-confident and better in their skin. And a lot of times this Ozempic face leaves you looking and feeling older and tired than you actually are.
Sometimes the fat in our, in our cheeks especially, that's what gives that youthful appearance. So when you're losing weight so rapidly and you lose the fat in there, it creates almost this like skeletization. You're losing fat in your temples. You've got the jowls going on, wrinkling around the mouth and around the eyes. So it just, and even skin texture. I mean, you think of like the dullness in the skin that can happen. Sometimes from not getting the right nutrients if, you're changing your diet or things like that. So it can have some pretty prominent features.
Yeah, absolutely. I mean, those fat pads are really important for our facial structure and youthfulness. And we see shrinking of those fat pads as we age. That's normal. We see that all the time. And that leads to, those jowls and, these deflated looks over, the lifespan. But when we see these patients on GLP-1s, we're seeing really rapid loss of those fat pads, and it's almost to a different extent than we see with normal aging. So there have been studies that are really looking into how these medications are impacting those fat cells, specifically in the face, and leading to this hollowed appearance.
Just the overall quality of the skin can really be impacted with, lack of hydration, and then just that overall, glow.
And we definitely have tools to help you reveal your glow. So we did want to touch on, ways that you can restore volume, especially if you're on these GLP-1 medications and noticing that volume loss. So just to kind of break it down and give you a little bit of overview, we're going to talk about a variety of ways to treat volume loss and skin laxity and give you that natural and youthful appearance. So first we'll talk about dermal fillers. This can include Restylane, Juvederm, RHA, the list goes on. But we're also going to touch on biostimulatory products such as Sculptra, Radiesse, PRP, and Exosomes. Then we'll get into like lasers and energy-based devices, so like CO2, erbium laser, non-ablative fractional lasers, RF microneedling, and, see how that can help restore volume and collagen.
Yeah, and we'll touch a little bit on, not even so much skin laxity, which of course is a problem, but as mentioned, skin texture, tone, quality, all of the things that come together to give us that face that we want.
Yeah, and I think a lot of, especially the laser and energy-based devices, they're not necessarily going to give you that volumization, but they're going to help stimulate collagen. And it might be, we'll talk later about how to combine different treatments, but really, if somebody doesn't necessarily need a lot of volume restored, but just needs a little bit of tightening, then those are great options too.
Yeah, absolutely. So I'm going to start off with discussing fillers. Fillers have become very popular, with social media and with the various offerings that are available. There's so many fillers on the market, and they all have different properties. So what we're using fillers, traditional hyaluronic acid-based fillers, we're actually injecting it in areas to restore volume. So hyaluronic acid is a sugar molecule that is actually in our skin, gives us buoyancy, volumization, also gives its youthful glow and hydration. So we're injecting synthetic hyaluronic acid into various areas to revolumize the face. That includes the cheeks, the temples. We can also use it to restore volume in the jawline. Those are the most common areas we typically, focus on.
The under eyes.
Yep, under eyes and nasolabial folds. So there are a lot of options, also using it for the lips. When we're looking at a patient, when I see a patient for a cosmetic consult, especially one who has had a lot of rapid weight loss, like with a GLP-1 medication, I am looking at the areas where they have lost the most volume and using these fillers to really kind of replenish that lost volume. So, whether I'm going to the temples, the cheeks, the nasolabial folds, the jawline, we're using various different fillers, which have different properties to establish that youthful look in a natural way. So they all have different properties, like I was mentioning. So like say something under the eyes in the infraorbital hollows or the tear troughs, I use a soft filler such as Restylane L or Belotero that are really soft, smooth, and they don't give that Tyndall effect, that bluish hue that you can sometimes see with poorly injected filler. Maybe it was the wrong product, not even the injection type, but that's really important. And for like areas like the cheeks, the temples, jawline, we want stronger, thicker, more dense, high G prime fillers to really help volumize and create structure. And softer areas like where there's more mobility and expression, like around the mouth, with the nasolabial folds. So there's a lot of artistry and science behind these fillers, but we can really create a customized look for our patient that looks natural, restoring their lost volume. So I do think that there's a lot of opportunities to use hyaluronic acid-based fillers in these patients. However, you can also use fillers such as Radiesse, so calcium hydroxyapatite. It's a totally different type of filler. It's not hyaluronic acid based, and we inject this in the skin, and I love it for recreating structure on bony areas such as, like the cheekbones, the jawline. It's really, really nice for that. So I do think that, you can customize based on where you see the volume loss and really getting that natural look.
Yeah, I'm glad you touched on that because I think a lot of people are under the impression that each filler is created equally and filler is filler. They have this concept that just filler is filler, and that's not necessarily the case. There are different brands. So, through Allergan, through MERS, these different companies, and then the viscosity of the fillers vary completely from product to product. So I think it's important that people know that.
I think also, too, whether you're using cannula versus needle. So, Dr. Zain, do you want to touch on the difference?
Yeah, so traditionally, we have injected fillers with sharp needles like we do with many injections. And, that allows for precision. It also allows us to kind of really know where we're injecting. However, that can also lead to, issues such as bruising. You can potentially, hit structures such as nerves and, other, items. So I do think that, although the needle offers precision, sometimes from a safety standpoint, I do sometimes prefer cannula, especially I love using it in infraorbital hollows where, we reduce the risk of bruising, which can be pretty brutal under the eyes, and also has a lesser risk of getting into a blood vessel and can lead to vascular occlusion, which means that you get filler into a blood vessel, which then basically blocks off oxygen and blood flow to that particular area of the skin, as well as other, tissues there, and can lead to death of that tissue. So I feel a little bit more confident, especially in those high-risk danger zones when I'm injecting.
What is cannula for those who don't know?
Yeah, that's a good question. I should explain that. So cannulas are these blunt tip needles. So basically, we use an introducer sharp needle where we create a little port, and then we insert these longer blunt tip needles that can manipulate through the tissue without severing, blood vessels or other structures to kind of move them out of the way because they're blunt tip. And it really reduces the risk of you cannulating or getting into a blood vessel, which reduces risk of vascular occlusion. Also helps me prevent bruising. So a lot of our patients appreciate that. But it does require a little bit of skill. There's a learning curve with it. But I do think that once you get the hang of it, it really offers a great experience for the patient because usually less painful than repetitive sharp needles. Reduces the bruising, which can sometimes last for a week.
Yeah.
And also, I love the safety profile. So I think patients feel more confident in an injector who has mastered that technique. And it's really catching on here in the US. I mean, I know that in Asia and in Europe, cannulas have been around for a while and they are really advocated for over there. And we're definitely seeing a lot more injectors using cannula.
Yeah, cannula is great. I do think these dermal fillers definitely have a place for giving you that immediate result if you're trying to volumize. You did talk about Radiesse, which traditional Radiesse can be used to give you that immediate volumization, but we'll kind of transition that into biostimulatory products. So Radiesse can actually be used to stimulate collagen as well. So it's called hyperdilute Radiesse. Which is what it means, hyperdilute. So it has the benefit of stimulating collagen production over time. Radiesse is a non-inflammatory gel that mimics connective tissue, and it adds volume, but it can also improve the skin structure, laxity, texture over months after the treatment.
I know we've been using a lot of Sculptra too. So Sculptra is another type of biostimulatory. It's poly-L-lactic, and so it actually uses an inflammatory response to trigger the body's natural collagen process. It's not something that's going to be your quick fix. I tell patients all the time, this is something that's happening in your skin for the next few months. That collagen production does take a little bit of time, so this is more of your long-term answer. I think we touched on it last time, like a vial for every decade, something like that. But, the nice part about the Sculptra too that I really like is that it's not only restoring the collagen and the volume, but it's helping to improve the skin texture and the tone. So, when people think of like that glass skin, I think that's where Sculptra kind of has its niche where it's multifunctional.
They sound very similar, Sculptra and Radiesse. So like the biggest differences between Sculptra and hyperdilute Radiesse, the mechanism of action we kind of touched on. The Radiesse is a non-inflammatory gel, whereas Sculptra kind of uses that inflammatory response to stimulate collagen. The duration is a little bit different. Hyperdilute Radiesse, usually we tell people it lasts about a year, could last about 2 years, but Sculptra has that kind of a little bit longer efficacy of lasting up to 2 years. The depth of injection does make a difference too. The aftercare too definitely plays a role. The Sculptra, you have a little bit more upkeep. You have to massage that area 5 times a day. Yeah, 5 times a day for 5 days, 5 minutes each time. Just trying to, clarify some of the differences.
Yeah. And I think with the Sculptra, I mean, a lot of people have heard about Sculptra from the past and, they hear horror stories of these nodules and people are scared to do it. That has all changed with the new dilutions that we're doing. So they're definitely more dilute and we're seeing a less incidence of those inflammatory nodules that form from Sculptra. Many patients would be pleasantly surprised to maybe try it because it's not like what everyone's talking about, like from the past.
And these products can be used more than, just in the face. We have the neck, the décolleté, the hands. Sometimes, during that weight loss journey, buttocks. I mean, and that's important because when you're losing weight and depending on what you're doing to lose that weight, let's say you're just running or doing cardio and you're not doing a lot of that weightlifting. Some of those areas kind of end up losing laxity and losing collagen. So it's nice to be able to utilize these in different areas to help kind of replenish that.
Yeah. And along that vein, I mean, we're talking about, inducing collagen synthesis. I know some people feel a little funny about, injecting something foreign into your body. They're really looking for a natural regenerative technique. So PRP, platelet-rich plasma, is another option. We're using our own body's growth factors to stimulate collagen synthesis. So what we do in the office, we actually draw your blood. We take that tube of blood, we spin it in a centrifuge, separate it. There's a layer of your blood which contains growth factors. we extract that and we actually inject it. And over time, it can help to, build collagen. Also helps with wound healing and inflammation, and gives you a nice glow. It's definitely a lot more subtle than these fillers, but it is an option that we can offer to our patients that, especially for those who are just a little iffy about putting something far into their body. I think it is a nice option.
Yeah, the nice thing about these biostimulatory products is patients will always say they feel like Benjamin Button. They feel like they're aging backwards. And so they definitely have a place to age gracefully. And most people don't know that you had something done. You just look kind of rejuvenated and just slightly revolumized.
I also have those patients who don't want a blood draw or get a little freaked out about like putting blood on their skin or injecting it. So there are also exosomes, that are, really making a big splash in the regenerative and aesthetic markets. It's not FDA approved for injection, but topical application has been used, and we're seeing some promising results. So I'm looking forward to seeing like the studies and what they will show for the future.
Lasers and energy-based devices we can kind of hit on next. So we use a lot of different devices in our office. We call them our toys.
My favorite toys.
So I guess we'll probably start with non-ablative fractional lasers, which we do a lot of.
So there's 2 flavors of fractional lasers that we use for helping to induce collagen synthesis. So non-ablative fractional technologies use wavelengths of light that penetrate into the dermis, create micro-injury, a wound response, and stimulates, the skin to produce more collagen and rejuvenate. Whereas ablative fractional lasers use light energy to target water on the surface of the skin and kind of creates these little microchannels of injury and also ablating portions of that to stimulate tightening, but mainly to improve surface irregularities such as pigment, tone, tightening. All those things can really help the skin. So those are those fractional lasers. And although they don't really restore volume, like we alluded to earlier, they do help with collagen production, skin quality, and can help enhance and be a nice adjunct to these other volumizing procedures that we do in the office. So, the skin is all kind of interconnected, and, improving the skin quality at the surface also can make a big impact along with the volumization to give you a really nice natural aesthetic. In addition to, the non-ablative fractional lasers, we also have microneedling technologies. So you want to talk about that?
Yeah, and I absolutely love the radio frequency microneedling. We've had so many patients now where we've treated their abdomen, especially, women post pregnancy who have like these stretch marks or just that sagging skin. It's, I think a lot of women don't talk about it really, but it's time and time again, we're seeing it. It's such a common problem. And the RF microneedling's really shown fantastic results on just tightening that skin. So, when you think about weight loss and how that connects too, I mean, you can treat the arms, that kind of saggy skin that's resulted from that weight loss, the abdomen, stretch marks where, once you've lost the weight, those remain. So we're seeing the thighs, the inner thighs. We had a patient, we treated her inner thighs and they look amazing. So all different areas that people don't really think of that the RF microneedling is really tackling just by tightening those areas and helping out, showing nice results.
Yeah. And what about like the jowls and like the neck? We've seen some really impressive results. And at the right depths, you can get some really nice tightening. And I know that at the wrong depths, you can actually get that paradoxical fat loss, which we really want to avoid. Yeah. So that's why it's really important to see someone who has that expertise, because we're seeing all those patients who've gotten like this weird like fat loss and laxity from, procedures with the Morpheus 8, for instance. So that's a big thing right now. So you can use those technologies in a safe and effective manner, but you really need to understand the science behind it.
Yeah, there's definitely certain depths that you don't really want to go past, and especially in areas like, the cheeks where you're not trying to dissolve that fat, you want to sustain it. But, along the jawline, definitely the tightening effect that we've seen is really nice. And I think that's where a lot of people tend to want to see their results who have lost that weight because of that sagging skin in the jowl. So just kind of tightening that area up. And then, of course, the improvement on overall skin texture, appearance of pores, wrinkles, fine lines, it's all a nice benefit.
Yeah. And the highly focused ultrasound, other technologies too can help tighten the skin and just kind of give that nice appearance, that skin tightening, in addition to that volumization with other procedures. Yeah. But honestly, I tell my patients, I have a lot of tools in my tool belt, and I like using a lot of them in combination.
Yeah, you can customize the treatment plan.
And it really makes a big difference. So I'm using my fillers for structure and volumization, biostimulation to help with collagen synthesis. I'm using my energy-based devices and lasers to kind of resurface and kind of improve. And they all kind of work synergistically to get you a really cohesive aesthetic result. And that's kind of what patients want, a natural aesthetic. It's not a one-size-fit-all. It's very customized, and it's a journey. It's not going to happen overnight. So we have patients who are with us for months, kind of working on this. And with the right treatments and the right sequence, we can see some beautiful results.
Yeah, I mean, even, one of our coworkers, we've seen her journey, and it's just been really amazing to watch the kind of before and after. One day we'll get her on here.
Yes, we will. I'm gonna drag her on.
But, and to speak to that, just different procedures. And I think it's been a nice journey because it's been a slow lead up to that. We're not just throwing everything on. Exactly. Yeah. It's, you don't want to rush these things. And I think being careful and being safe are obviously top priorities. But then, getting those results is second priority, and it's been amazing to watch her journey through. Yeah,
Dr. Zain, I think you found a really good article about a patient who had a combo of treatments and her before and afters on the screen here.
This actually came out very recently. This woman was treated with Restylane products, I think specifically Restylane Lift and Contour, as well as Sculptra. And as you can see, she has volumization. She had been on Ozempic, that's her before photo, with the volumization and then the biostimulation with Sculptra. You can see a beautiful natural result. She looks rejuvenated. And yeah, I mean, that's the kind of result that we're looking for to help these patients feel their best, feel confident in their skin.
I like that, like on this picture too, you can see like in the first picture, her smile, just normal, but she's just got that little upward curve, and it's just, you can just tell she probably is so ecstatic. Yeah. It's like a nice little tidbit in there.
And her skin's glowing. It looks really, really good, natural, and I'm sure she's thrilled. I mean, look at that jawline.
Yeah, the jawline alone, and then just even the pigment it looks like, which, sometimes that I think tends to age us to sun damage over a lifespan that we accumulate.
Yeah. I think it's important too to combo these treatments with, skincare at home, making sure you've got great skincare, hydration, making sure you're wearing sunscreen every day, and that can help keep your results maintained.
I always tell my patients, you go to the dentist twice a year. So in between those trips, what are you doing at home? You're brushing your teeth, you're flossing. So it's the same thing with skincare. I mean, you can do all these procedures, but if you're not doing the at-home care, it's, a little negligent. You're spending all of this money. You want to make sure that you're keeping this investment worthwhile.
Yeah,
absolutely. I mean, I think this has been a great discussion on the phenomenon known as Ozempic face, but just the skin changes that we're seeing with these GLP-1 agonists. And I do think that patients who are on this need to know that there are options. If they're loving the results that they're seeing in their body, but they're not feeling great about how their face is looking, there are ways for us to help them, and safe, effective tools that we can provide for them.
You're not alone. Other people deal with this, skin sagging, the volume loss. It's very common. So there are definitely multiple treatments that you can do for this, but you really do want to see someone who knows what they're doing and is experienced, like Dr. Zain, just because the cost that you will spend fixing that problem is a lot more than what you would probably spend in the first place.
Yeah, and we're always here to help guide you and ensure that you're getting the most effective treatments to help you meet your goals.
Yeah. So thanks for joining us on our latest episode of Skinside Out, where we talk about all things skin health and beauty. This was a really enlightening, discussion. And if you have any questions, let us know. But don't forget to like, subscribe, and follow us. Skinside
Out.
Thanks for listening. This episode of Skinside Out is complete. If you enjoyed today's episode, don't forget to subscribe, rate, and leave a review wherever you listen to your podcasts. For more tips, updates, and behind-the-scenes content, be sure to see what fun we're up to on TikTok. Follow us on Instagram and Facebook at Nor Dermatology and Aesthetics. Check us out online at norderm.com. Discover why our patients give us 5 stars on Google. Call us today at 919-617-0717.